Have you adopted a child and believe that they may have reactive attachment disorder? I'm Christy Bundukumar, psychiatric nurse practitioner with over 20 years of clinical experience, but I have also adopted 5 children. And so I have some experience in reactive attachment disorder, both professionally and personally. So what is reactive attachment disorder? We are in this series called Demystifying the DSM, and we have started the chapter on kind of trauma and stress disorders. And reactive attachment disorder is the first one in that series. Now, this has to occur prior to age 5 years old, and it is considered a childhood disorder. However, children with reactive attachment disorder likely will grow into adults with attachment and social issues. Remember, this is not a developmental disability, this is not an intellectual disability or an autism diagnosis. So those things would be diagnosed separately and with more of a like neuroeducational testing. Reactive attachment disorder is a behavioral social disorder that happens when in the primary years there is some emotional neglect, and this often happens with adopted children. So I'm going to go over the criteria that the DSM talks about, but I always find it a little difficult when the DSM does not line up with my personal experience or my professional experience. So I will tell you exactly what the DSM says that the criteria is for meeting reactive attachment disorder, and then I will tell you a little bit about my personal experience and professional experience with reactive attachment disorder. So the first, with all DSM diagnoses, there's often multiple criteria that need to be met. So criteria A for reactive attachment disorder is they actually must meet both things listed, that they rarely seek comfort from their caregiver, and if they do seek comfort or you try to give them comfort, they do not respond to it. And so that is criteria A, and it is considered a must. Now, I can tell you from personal experience that it was not necessarily like that. I have one of my adopted children definitely has reactive attachment disorder, and it was more like a tug of war. It was, I'm going to seek attention from you, I'm going to seek love from you, and then I'm going to do something to sabotage it. So just because it doesn't meet, this very specific criteria, you could have your child evaluated by a professional to see if they meet this reactive attachment disorder, because I kind of disagree with this, kind of clear, must meet both of these criteria in A, because the way it is written, it's that they don't seek comfort and don't respond to comfort. But I find that many of these children are very reactive, very have a desire to try to attach to somebody, but then they sabotage that. They don't actually trust any of that attachment. Criteria B for this reactive attachment disorder is that there is minimal response when you are trying to show your love. And I can tell you that this is over and over again, and oftentimes goes into their adult life, especially into their relationships, that there's minimal positive effect when you are giving that love. So, one of the things when I adopted children, I really believed that if I just loved them, that they would feel that love and they would be healed from the neglect that they experienced early in life. But it was way more complicated and difficult than that. And also in this criteria B, there has to be some kind of emotional reactivity, irritability around these attachment relationships. So we have criteria A, B, and C. A are those 2 that I said you had to have. Criteria B has 3 things listed, And you have to have 2 of those 3. So those 3 things are minimal response to someone trying to love them, limited positive effect to that, and having some sort of reactive behavior of irritability, pushing people away. And I find this to be true of every child that I have diagnosed with reactive attachment disorder, that they have at least 2 of these things. And then the last criteria is that they actually have the neglect. And so, this is why I started with, have you adopted children? Because, this happens quite frequently. In foreign adoptions, many of these children are grow up in institutions. They have minimal caretaking, just like physical needs, not emotional needs, not being held enough. And so that is definitely one of those, clear neglects. I know that for my daughter, who has reactive attachment disorder, she was the youngest of a sibling group, and so was immediately taken from her family and was in foster care from the time she was born. And so I know that neglect in a family home is bad, but for her, I believe it was even worse because she never actually was able to connect with her biological family because she was taken at birth. And so, the theory behind this is in those first 6 months, if we look at Erickson's stages of development, in that first 6 months is trust versus mistrust. And this is where they need to have, infants need to have an emotional bond. It doesn't have to be with a biological parent, but you do have to have an emotional bond to be able to trust emotional bonds in the future. And I'm not saying that reactive attachment can't be treated. There are many kids who are treated and go through lots of counseling, learn how to trust the people that love them. But we do have to bring that to the forefront and remind them why they're feeling like this, remind them why they're having difficulty attaching, especially when they get into the teen years. So early on, if you've adopted a child, early on, let's say age 7 and below, just attempt to give them that security and that comfort that they missed, in those first 6 months of life. From about 7 to 8 to teen years, I would begin having, very simple conversations with them. You're not receiving mommy or daddy's love. How do you feel love? And then you can start doing things like, trying to experiment with what is their love language and what kinds of activities or things that you do make them feel love, right? During those ages. If you have a teenager and they know they're adopted, this is the time to really begin having that conversation about, some of the problems that we might be having might be due to your difficulty of really believing that we love you. And I say all of these things because I did not do it like that. I adopted children that were older. They were 9, 10, 13, 15, and 18 when I adopted them. And I just jumped right in, trying to express love the way I express love, and and some discipline. And it really kind of backfired when they became teenagers. It was, you don't really love me, and I didn't have the solid relationship that I wish I would have taken the time to do. So if you know my story, you know that I really believe that at this time in my life, as I share my struggles, share the things that I have done right and wrong, and the things that I have learned in the process, I hope to be helping people with that. So today's video is about reactive attachment disorder, which oftentimes is in adopted children. And I know there's so many of you out there who have given your heart to adopted children. And I just say, do not give up. It is not as easy as we thought, but the rewards are great. My children are functioning adults, and they like me most times. And so, just remember that it is a process. It is a marathon. Raising children, even your own biological children, is a marathon. But raising adopted children, especially with reactive attachment disorder, you have to think of the long haul. Don't give up, but setting healthy boundaries, continuing to express love, and oftentimes you'll need some professional help. There's counselors out there that specialize in reactive attachment disorder. And then also consider like a full psychiatric evaluation if there's significant, mood and behavioral problems. Because also many mental health conditions are genetic, and we don't know what their foundation was. And we want to give them their best opportunity. So reactive attachment disorder is behavioral. It is from their neglect and trauma. But remember that there could be some genetic underlying things that need to be treated. So it can be comorbid with other things. And it can also, especially if their trauma was later in life and they remember that, and it was not just neglect, there could be some PTSD, and we will talk about that in other videos. So God bless you for adopting children. You can do this. Get help if you need it. But remember that this is about their fear of attaching, and then so they are reacting to that. And so we have to be the healthier, the stronger one. I believe that you are mentally strong, and I believe that you can raise mentally strong kids. If you got to the end of the video, you obviously enjoyed some of the content. I have a lot of free content out there. I am really trying to empower everyone to find their mental strength. So subscribe, get the actual notifications, and let's embrace this journey of mental strength. See you there.